is about. Welcome, Alan, and thank you for presenting to our group.
Well, thank you. I'm so excited to talk about this topic. It's a very interesting topic, and it definitely, through the research that I've done, I definitely think it's made me more of a well-rounded clinician. So I first want to start off by talking about the National Network of Healthcare Hygienist. So this is a website that you guys can go to. They have different certifications. So I'm still in the middle of getting my certification for oncology. I've completed the complete coursework. Now I'm just doing my cohort so that way I can actually get certified in oncology to partner with oncology units. I am setting up meetings with oncologists throughout the Tampa Bay area to go over the need of patients being screened before, during, and after cancer treatment to help with the treatment that they're going over. This network has a lot of different certifications that you can get. They have one specifically in just oral cancer, and the one that I want to do next is all the systemic links to periodontal disease. So today, my goal is for all of us to better understand the biology of cancer, and that includes understanding the lab work that goes into our patients. Definitely talking about nutrition because that is a very big topic to prevent oral and systemic issues during this critical time in the patient's care. Talking about pharmacology, complications, and our treatment modifications as dental professionals. So first things first is early dental improvement is going to help get this patient through their cancer treatment. The number one reason why patients have to stop or cancel their treatment altogether is because unmet dental needs, and that includes decay and periodontal disease. When we talk about chemotherapy and radiation, this is very, very, very important that we stop anything that's going in the mouth before they start this. And our role as in oncology units is to really help improve the quality of life when we talk about nutrition, because nutrition is also going to help impact their eating, speaking, and how they hydrate. And it lowers healthcare costs and improves survival rate. So when we talk about healthcare costs, and we have to stop the treatment, whether it's chemo or whether it's radiation, that actually costs the patient a lot more money. So for example, mucositis, which we'll be talking about later on in this presentation, when someone has mucositis and they have to stop their treatment, that's about $2,000 to $3,000 that the patient has to pay extra per day just because of this dental need. When we talk about oral infections and sepsis, those cases are about $20,000 to $50,000 if they need to go into an ICU care unit. When we talk about feeding tubes and nutritional support, that's an extra $1,000 per day for the patient. And then obviously when we delay any type of cancer, they may need more type of treatment, which is thousands of dollars lost in the patient's pocket, but also the hospital pockets as well. So first we need to understand the biology of cancer. So cancer is just a disruption in the body's cellular mechanisms, and this typically happens in the cell cycle. So when we take a look at the cell cycle, it really reminds me that our bodies are very compromised to a lot of things going wrong. We have billions of cells in our bodies every day, and they're dividing very, very fast. And when they're dividing, if there's anything that goes wrong in that division, that's when cancer can potentially happen. So the first stage is going to be that gap phase where the DNA is starting to replicate. And then we go into the S phase, which is where the chromosomes are copied. Then we're going to go into the G2 phase, which is where they start to divide. And then obviously they divide into two identical cells. Now, during that cell cycle is when things start to come kind of crazy. And so there's different factors that can manipulate those cells that causes cancer. So the first one, which is what we all typically hear about, is going to be your genetic factors. And those are going to be called your BRCA genes. And this is going to be your family history of cancer. While going through this program, the reason why I got very interested in this topic is because both of my grandparents and majority of my family do pass away because of cancer. And so I always thought that it was just a genetic link. Like if, multiple people in my family, multiple lineages are getting cancer, it has to be genetic. So I actually signed it up to get the BRCA gene test. They came actually to my house to take my blood, took it to the lab to check out to see if I have any genes. And the good news is I don't have any genes that are predisposable to cancer. And what I found out through that is only about 5% of cancers that are diagnosed are because of genetic factors. So when we talk about genetic factors, it's a very low percentage of why someone may or may not get cancer. When we move forward to environmental factors, that's when we talk about tobacco, alcohol, radiation, chemical exposures. That's really where I think that my family is probably more prone to getting cancer. I'm from a small town in Muncie, Indiana, and it was a factory city, and both of my grandparents and most of my family were actually factory workers. That's where I think that they got the exposure from. We've all, I hope, heard about the HPV virus and how that is linked to oral cancer. That is also an agent that can cause that. And then also your lifestyle. So your poor diet, obesity, stress, things like that can also cause a lot of harm to the body. When we talk about how different things can cause cancer, we want to look at the cellular level. So when we look at cells, they're made of lipids. And so that's typically how things start to get entered into the cell. And that's how things can kind of get messed up during that cell cycle. So the first one is, how does bacteria and viruses enter the cell? Especially when we're talking about the dental professional, we are always concerned about the bacteria in the body. And what is actually happened is the bacteria doesn't typically get inside the cell. What happens is it passes through, or the bacteria actually takes over the cell, and the toxins from the bacteria can take over the cell to kind of break down that structure. When we talk about viruses, they really just hijack the machine of the cell. So they have different receptors that link onto the cell and changes that DNA or alters that DNA or damages that DNA, which is what is causing that malfunction and that cellular divide. And that's really what's causing that tumor growth. And the next, we need to understand the lab work. And I have a really cool story about the lab work, especially when it comes to platelets. So, what are platelets? Platelets are what helps our body clot, especially once we, get done doing a scaling or root planning, or if we got a cut. That is really what's helping the clotting and the healing. And so, when we talk about patients who are undergoing cancer treatment, we're talking about low platelet counts, which can increase the risk of bleeding, slower healing, and it could really start to cause an issue where that bacteria is really progressing and the body can't clot or heal itself. So I had a patient in the chair while I was taking this course, and I probably have seen her, I want to say 2 or 3 years. She's been a patient of mine on a perio maintenance 3-month recall. And I kind of noticed that her lower anterior in between 24 and 25, it just looked very rubbery. The gum tissue didn't feel like it was actually like attaching to the tooth, and it just wasn't something that I've ever seen before. So I asked the patient, I said, "Hey, I know we went over your medical history already. Are you sure that there's nothing that's changed?" And she looked at me and she goes, "Why are you asking that question?" And I told her what I'm seeing, and she was like, "Well, my doctor thinks that I have a low platelet count." And I was like, "Oh, that actually makes sense." And I was like, "Do you have that lab work with you?" And so she got on her app, and she showed me the lab work, and her lab work, her platelet count was very, very, very low. And I was like, "This is probably explaining why I'm seeing things in the gum." So I told her, I was like, "I can't move forward with your periodontal treatment today. What I need is a to send you home with a release for your doctor to make sure that to know that you have periodontal disease, to make sure what I'm doing today you can receive." I'm so glad that I did that because her doctor actually told me to postpone everything because of her platelet counts being so low and they didn't know what was going on in the body. So I'm very, very happy and blessed that I knew this information. The patient was very happy that I knew this information, and I think it gained a lot of respect for her to trust me. But I also think I gained a lot of respect from my doctor that I work with, because she was like, "Why are you asking me these questions? Like, why is this happening?" So it was a really good learning curve for the office. Next is going to be your red blood cells, which is what is carrying oxygen. So when patients are having low oxygen in their red blood cells, they're going to have a little bit of a harder time getting through our dental appointments. So this is where we might want to extend the appointment, maybe do, quad dentistry, one quad at a time, and not doing everything all together, and just making sure that the patient can tolerate dental procedures. Next is going to be your white blood cell count. So white blood cell is a part of your immune system. So when we have low white blood count, this is when infections can occur, delayed healing, and even sepsis. So it's really important to make sure that we're looking at the blood levels, which I have over here on the side, because if it's too low, the treatment that we may be doing for that patient is really putting that patient at risk. And it's always important to collaborate with the oncology team to make sure that the treatment and the timing that we're doing is safe.
Excuse me, Alan, 1 second. Somebody is saying that they're having a hard time. If you could increase your volume, is your volume all the way up?
Yeah, my volume's all the way up.
Okay, maybe just speak a little louder. Maybe it's on her end. Sorry,
Okay, yeah, no problem. Let me know if it gets better or not.
I will.
So next we're going to talk about neutrophils. These are also considered a white blood cell, but these are a little bit more infection. When we have a low neutrophil count, this is where high infection risk can happen. So it's important to know this as well, and prioritize oral hygiene instructions and gentle dental hygiene treatment. So later on in the presentation, I'm going to kind of combine all of this together, and talk about modifications. So for example, if a patient has low platelets or they have low white blood cells, it might be important to tell that patient to not puncture their gums at home. So it might be where a time where we're going to tell the patient to not floss. Because if we're flossing and we're puncturing that gum while they have this immunocompromised system going on, we can actually enter that bacteria into the blood, which is going to set up for infection for the patient. So knowing these lab ranges and knowing the conversations to have with the patient is going to be important when it comes to talking to patients to get through their care. So next is the nutrition, which is going to be very important. So obviously, when we don't have good nutrition, that's when our body starts to weaken or decrease. When we are talking to a patient that is going through chemotherapy, their body is kind of like a very, very, very fast engine. And no matter how much we try to get into their system, their body just can't keep up with it. And also with their dry mouth and other dental problems, it can be harder for them to keep up with their nutrition diet. Cancer and the treatment can lead to malnutrition, weight loss, and nutrition depletion. Side effects are going to be your mucositis, your xerostoma, and it can make it difficult for the patient to eat. So the first thing that we need to do when we're talking about nutrition for the patient is to really sit down and talk to them about keeping a diary with them so that way we know what foods that they're eating, so that way we can have a better conversation with them. We might need to be talking to them about a soft, high protein foods. And when we are talking about soft foods, that can be foods that are being blended or protein shakes to really help making sure that they're getting enough protein. And we really want to kind of reverse the low calorie mentality when we talk about diet. We really need that patient on a high calorie diet because, again, their body is moving faster than they can keep up. So, the more calories that they can have, the more energy that their body has to keep up with the treatment that they have because they're going to lose weight very, very fast. And we all know that a low calorie diet is how we lose weight. We don't want them to lose weight. We want them to maintain or increase their weight. The next is going to be an electro-rich fluid diet. So if the patient is drinking water, putting electrolytes into that water to make sure that they're getting enough ingredients in their body to help fight off any dry mouth. So some clinical tips for us as hygienists is it's best to make sure that we tell them, obviously, don't drink any type of soda because that's going to be an acid attack. That's going to increase your chances for cavities. Having a conversation about, a high carb diet also isn't going to be very beneficial because that's going to break down into sugar. Collaborating with the oncologist dietitians for their nutrition support and encourage their oral hygiene and improve comfort during eating. During the course, there was a hygienist that was on that works in an oncology unit. I want to say she works in Minnesota, and she works with the dietitian every single day. Her and the dietitian actually go into the patient's unit at the hospital and they actually do their assessments together. So that way they can both come up with a diet that is going to be good for their oral cavity, but also make sure that they're getting enough nutrition to keep up with the care that they have. The next section is pharmacology. And I'm going to be completely honest, when it comes to pharmacology, it confuses me. So I have a couple of tips for you guys that can help when we start to see medications that we're not typically used to. So when we talk about chemotherapy, there are different classes when it comes to that. The main thing that I kind of want to get around is the oral complications. Each class has a different oral complication in each one. So that can be an altered taste, that could be mucositis, delayed healing, oral infections. And so there is actually a website that I use during my clinical practice. It's called drugs.com. It is the best website if you don't know what drug you're talking about. So what you do is you just enter the drug name and it will pop up the drug. And there's actually I guess a button that you could push that actually tells you the oral complications from each medication that the patient has. So that way you can write down a take-home report to the patient, like this is what your medication is doing inside of your mouth. And it's a better way to communicate to the patient that oral systemic link. There is one drug that is highlighted here in red that I do want to talk about. They actually call this the Red Devil pill. When patients are on this, it completely wipes out their immune system. They have no way of fighting off any type of infection at all. So, when we talk to medical professionals, it's very important that when they get on this drug specifically, they should always have a dental exam and a dental clearance before being put on this medication. I do want to talk about opportunistic infections. In my areas of expertise, I think this is one conversation that we miss as individuals. So, an opportunistic infection is an infection caused by any type of bacteria, any type of virus or fungi that is exploited during a weakened or compromised immune system. And so, everything in the mouth is opportunistic. When our immune system is low, that is going to allow for the bacteria in our mouth to really take over at a faster rate. And so it can put the patient into an increased risk of mucositis, xerostomia, candidiasis, bacterial infections, and it can also affect the lab works that we talked about earlier. I actually had a opportunity to go speak to a nursing home earlier this week and to talk about, nursing homes, opportunistic affections inside nursing homes, and get them. I brought an iTero scanner with me to scan them, to do oral health assessments, and talk about perioprotect. But I was very surprised that the nurses on staff really didn't have a lot of knowledge when it comes to the infections that are inside the mouth. So it was a very cool experience to have with the nurses on staff to talk about what they can do inside the nursing homes. The one thing that I did talk to them about is this one nursing home was still using the chlorhexidine sponges to clean the patient's mouths. And so I talked to them about, switching that out, getting toothpaste. Hopefully we could partner together to do PeriProtect inside that nursing home so that way we can help the patients better. Next is going to be your dental assessment. So I am currently working with some oncologists who specifically send patients to me, since I have this certification, to pre-screen these patients before they go into their cancer or radiation treatment. So the first thing you want to do is you want to identify what type of treatment that they're getting. Is it going to be surgical? When we talk about surgical, we're also talking about ports. Is it radiation or is it medical, which is going to be your chemotherapy? Why this matters is because the different types of cancer treatment is going to put the patient at different risk. So when we talk about radiation, we're going to talk about osteonecrosis and xerostomia. When we talk more about chemotherapy, that's going to be your mucositis. That's when that immune system is really going to be lowered. And then surgery is going to be, the structural changes or the healing issues. So we want to be aware of any types of surgical wounds or flaps that the patient has. We want to know if their mouth has a limited opening, if they have difficulty swallowing, if they have any type of port or a central line in that body. So that way we can hopefully get that patient on a pre-med before any dental treatment. Um, we also want to make sure that we look at their airway, and also make sure that we are taking very extra precautions when it comes to aerosols. These patients are very at risk for high infections, and we all work in an environment that thrives in aerosols. So there is a pre-assessment. So we want to take a look at the medical history, make sure that they don't need any type of pre-med. We need diagnostic radiographs that includes an FMX and a pano, full mouth, hard and soft tissue examination, caries detection. We need to look at the pore restoration integrity of each tooth, the periodontal assessment, endodontic assessment, and check for any type of ill-fitting dentures. So when we talk about removing any types of infection, most of this should be done with at least 14 days before any type of cancer treatment, especially radiation. So when we're talking about dental extractions, that needs to be done 14 days. Realistically, it's going to be important that that patient does come back for a post-op. Even if it is just a single extraction, it's definitely important for them to come back for that post-op before that radiation, just to make sure all of your bases are covered. Any affected periodontal disease should be done 14 days before, and endodontic infection. I do want to talk about the integrity of your restorations and your integrity of your dentures. So when we talk about mucositis, we're talking about a very fragile environment, and any type of rubbing is going to cause that. So if the patient has any type of overhang and they're trying to do their home care at home, and that overhang is catching that floss and that floss keeps breaking, that's going to cause an environment where that tissue is going to be manipulated, and it can cause mucositis. And when we're talking about dentures and they're having any type of rubbing or discomfort, that's going to cause that ulcer to start wherever that area is rubbing. When we are assessing the patient, it is important to deliver the standard of care. There is no watching. There is, if a patient has a incipient lesion, we need to treat it at that stage, because the treatment that they're about to go under can really cause that incipient lesion that we're watching to turn into something that can cause that patient to not go through the treatment. So there's no watching. It's giving them the care that they need to make sure that they're getting through that treatment. If you see something that you're like, oh, I don't really like how that looks, but maybe we can look at it next time, there might not be a next time. We need to treat it before they go through that treatment. Some possible irritants are going to be your ill-fitting dentures. Also, any type of orthodontic bands or brackets. The reason why I put that is because one of the patients that were referred to me still had the Invisalign buttons on. And so I asked the patient, I was like, how long have these buttons been on? And she was like, oh, I had Invisalign done like 3 years ago. I just never did my follow-up visits. And so I made sure that to have that conversation with the doctor to take off those buttons so that way it's not causing any type of irritant, especially if they still have orthodontic bands on. I know many patients that still have their bands on, but they're not going back to their orthodontic for whatever reason. It's really important to have that conversation with that patient that those orthodontic bands really need to be off before you even start treatment. We could provide custom fluoride trays and put them on a prescription fluoride paste, kind of like Climpro or prevalent, anything like that. We also need to talk to them about dry mouth because xerostomia is going to happen no matter what stage that they're at. So there's different products out there like Spry, Biotine. I really like the GC dry mouth. My patients really do love that. And we also need to talk to them about mouthwashes. We want to get them away from any type of alcohol mouthwash, such as like Listerine. When patients are going through this treatment as well, they're going to be very sensitive to taste, and taste can really turn them away from using a mouthwash. So, using a mouthwash that doesn't have such a potent taste is going to be important um, throughout this time, and talking to them about lozenges as well to help them keep their mouth moist during the treatment that they're undergoing. I do want to talk about the recalls for the patient. And so I think that this is kind of like a taboo in hygiene. And I want to talk about this because it's very important for patients that have an immune no compromised health. So I do have a couple patients that are suffering with HIV, and I have them on a 1 month recall because I cannot get their gums under control no matter how much I try. And having them coming in every 3 months for a recall just isn't working. Once I got my HIV patients on a 1 month recall, I've actually been able to help control their periodontal disease a lot easier. So when we're talking about patients that are undergoing cancer treatment and their periodontal disease just isn't stable, it might be a conversation to have with them to come in once a month to have their periodontal treatment or their prophy even once a month to make sure that we're controlling that microbiome that's inside of our mouth. So it's just important that we assess every patient and assess their needs. And sometimes those needs kind of go out of the normal for those patients to make sure that they're being taken care of. Um, Talking about strategies at home, that's going to be your fluoride and making sure that they're getting that varnished about 3 to 4 times a year, even after treatment, because after treatment, their bodies are still trying to heal. So making sure that they're getting that prescription at your office each time that they're being seen. Each and every single appointment with the patient, we should still go over their diet changes just to make sure that we're taking a look at their cavity risk and helping support them that way. Tobacco cessation support, we should always be talking to our patient no matter what stage or how healthy they are because we know what tobacco does to the mouth. And managing long-term side effects such as xerostomia, trismus, swallowing dysfunction. I do want to talk about trismus just a little bit, so limited opening. So there are some exercises that you can talk to the patient about the opening. So the one that the program that I took recommends the most is using popsicle sticks. So stacking the popsicle sticks one on top of the other and having the patient bite on it and adding one to where their mouth opens just a little bit more and holding it there for at least a minute to 2 minutes and keep doing that every day to really help open up that mouth. This isn't only going to help us in the dental field to take a look what's going on inside, but this is also going to help the patient eat and function normally. So the complications of cancer treatment, the first one's going to be mucositis. So mucositis is a very painful inflammation, and it's just ulcerations of that mucous membranes. This is going to be caused by your chemo and your head and neck radiation. So what this typically looks like, it does look like an ulcer. It can also happen on your tongue, the floor of the mouth. So when we take a look at this patient, so I kind of want to take away the mucositis part, let's take a look at their teeth. When I take a look at their teeth, I'm definitely seeing that calculus buildup and I'm seeing that staining. So that's telling me that this patient has poor home care at home. So one of the things that I wish would have happened to this patient is removing that calculus before they started this treatment, talking to them about the home care and the needs of having this done to really help prevent this from getting to the point where this photo has went to. When we talk about how this can also look inside the mouth, is it can also look very shiny and red. The patient is going to complain about white or yellow areas that are coming out of their mouth, and it's typically also going to burn as well. So the onset of this is typically 5 to 7 days of chemotherapy. So if we're when we get a patient that comes into our office and they're saying, "Hey, I'm going to go through chemotherapy," it's very important to know how long their treatment is going to be and how consistent is their treatment. Are they only going in once a week? Are they going in twice a week? Or are they going in every day for 3 weeks to get this done? Because that way we can know that, if you're doing this 5 days in a row, you're probably going to be set up for mucositis. So we want to make sure that we kind of prevent this. And so for this patient, I'm going to say that's tooth number 2, that patient does look like they have a cavity on that line of the tooth next to the gingival margin. And look at all that calculus and all of that staining and that bacteria that's just sitting on that one tooth. That is really what's causing the microbiome in this patient to kind of get offset. And that's why they're having this mucositis and having all these signs and symptoms in in an area where they're already uncomfortable because they're undergoing chemotherapy. So to prevent mucositis, first things first is to uh, create urgency around dental treatment. Fluoride trays to help maintain the integrity of the enamel is going to be very important. Like I said earlier, it's going to be very important to talk to patients about using products that don't have a lot of taste. So when we're talking about mucositis, they're going to complain about burning. And so certain chemicals inside of our mouthwashes can actually trigger that burning. So talking to them about a baking soda and salt rinse is going to be important. It's going to be 1 cup of water to 1 tablespoon of salt and 1 tablespoon of baking soda is going to be that perfect equation to help relieve some of the pain that they're having. Also, it's going to be important to talk to them about cryotherapy treatment during chemo. So that is meaning that while they're going through this treatment, maybe they should be sucking on ice. Keeping that area very cold can actually help keep the integrity of the oral cavity. In certain chemo units, they actually have something called a cold cap. So they have this, it looks like a helmet that the patient puts on, and it's kept in a freezer until the patient needs it. But they actually put the helmet on the patient while they're undergoing chemo treatment. And the reason why they do that is because it has been proven that keeping the area cold can actually help save the patient's hair. And that's one of the major side effects of chemo is patients lose their hair. But what patients don't understand is hair is going to grow back, but your teeth is not going to grow back. So why don't we also use that same technology and use cryotherapy inside their mouth during this treatment to help prevent against mucositis? And then we also need to talk about hydration, talk about electrolytes while they're undergoing the chemotherapy and making sure that they're eating a soft diet so nothing is irritating that mouth. Now, when we go back and take a look at this photo, Just imagine a patient having a denture that is not fitting correctly and that is rubbing any certain area. It's going to be very painful. And especially if they're in a full upper and a full lower denture, how are they going to eat? It's going to be very uncomfortable. How are they going to get the nutrition in them? That's when, the dietitian unfortunately has to come in and say, hey, we're going to put a feeding tube in. When we're talking about feeding tubes, that's going to put an increased risk of opportunistic infection. That's going to cost the patient way more money. It's going to cost the hospital way more money when we could have done the right thing by doing a dental check or doing some type of assessment and making sure that everything's good to go in the mouth before they go through the cancer treatment. With mucositis, it's very high for the patient to actually go into sepsis. So there's a couple of things that you want to look out for, especially if you're treating the patient in your dental office. So when a patient is going through chemotherapy and we know that they're feeling very weak, this is going to be a very good time to actually take a temperature of your patient. I know that typically we only do high blood pressure. Maybe sometimes we do pulse. But for these patients, it's very important to take their temperature so that way we know where they're at. I actually, in my office, I have a thermometer in my room for patients that I'm seeing for this. If a patient is having a rapid heartbeat or breathing very heavy, this could also be a sign that there is something major that's going on. If the patient is, very confused during your dental appointment, it might be important to make sure that they also have a caregiver or someone who has like the power of attorney over that patient to make sure that you know that they're not going under sepsis. And just making sure that you're asking the patient, how are they feeling today versus yesterday? Those questions are really going to allow you to know if that patient is feeling strong today versus the rest of the week, or if this is a treatment that we may need to hold up on and get the patient rescheduled. So in our role, it's just important to recommend hygiene products that aren't as abrasive. Stay away from alcohol-based rinses or anything that's going to irritate. Um, Probably recommend some type of sodium bicarbonate or saline rinses like we went over, and just work with the oncology team to prevent any type of pain. And if they are going through pain, what that pain management is going to look like. Next is going to be your osteonecrosis. This is typically going to happen when patients are going through radiation. So some common areas where this can happen is the medications like biphosphonate that the patient is using. Some risk factors that can cause this during radiation is going to be invasive dental procedures, such as like extractions. So again, that's why it's important to make sure that any type of extractions or any type of dentistry at all is done 14 days before they undergo this. Ill-fitting dentures is going to be a very big one, and any type of medication that the patient may be on after radiation could also cause areas like this as well. So now we're going to talk about periodontal disease, which is what I love to talk about. So oncology patients are going to be known to getting the NUG and NUP, which is the necrotizing gingivitis or periodontal disease. This can happen very sudden. It's very painful. It's ulcerative. And so the treatment to undergo this is going to be a debridement. Again, you want to make sure that you look at the lab results, looking at the platelets, looking at the neutrophils, because if the patient has low platelet counts, if they have low white blood cell counts, it may be important to make sure that you don't debride underneath the gum subgingivally, because once we get underneath the gum and we introduce that bacteria into that bloodstream, that's really going to cause major issues during this time. So staying above the gum is going to be very important during this. I thought it was very funny. I guess I shouldn't say it's funny, but I thought it was very interesting during the webinar that they recommended chlorhexidine during this time. I don't know if I would necessarily recommend chlorhexidine just because it does have that alcohol in it. I may switch it over to like an iodine rinse to make sure that the patient has something to help keep that bacteria load down and to make sure that no burning happens. And then also, this is another good time to talk about systemic antibiotics to treat this. So, I actually had a patient in my office that had the necrotizing periodontal disease. And I have never seen anything this bad. My doctor has never seen anything this bad. And we kind of were just like at a loss of words of kind of what to do. And so I recommended systemic antibiotics to my doctor, and she goes, I never really thought of that. So we went to the drug.com, which I talked about earlier, and we did some research and we found a low dose of tetracycline to put the patient on before we even start treatment to try to get as much infection down before putting any type of instrument on that patient to help the patient better do it. I decided to not do the full mouth. I decided to do it quad by quad. So I did one quad of the scaling and root planing and had her come back the next day. And I made sure that I created the urgency that, hey, like you have to come back the next day to make sure that you're healing correctly. And she came in Monday, Tuesday, Wednesday, Thursday. I finished the complete SRP. I did put her on the iodine rinse and she healed up very beautifully. And it was a very fun case, but I think that is just where you got to use your critical skills, partner with your doctor in the oncology unit, and just get the patient the care that they really need and deserve. Viral infections, which is going to be your HSV, your VZV, and your CMV. This is going to happen during any type of cancer treatment, but especially your stem cell transplant. So any type of viral infection is always going to pop up as painful blisters that are going to rupture and they're going to cyst, and this can cause the patient to have fevers or feel very, very sick. This is when a systemic antiviral is going to be needed. Sometimes the one patient that the program did teach me is the patient did have this small little cyst on the side of her lip, and the nurse and the doctor on the oncology unit just thought that it was just because the patient had a dry mouth. And so when the hygienist on the oncology unit went in to do the assessment, she was like, hey, that patient has a herpes blister on the side of the mouth. And both the doctor and the nurse was like, no, like the patient's lips just dry. And because of what we do every day and we're so focused on the mouth, the next day the patient did have more blisters and they were able to put that patient on an antiviral treatment very early to make sure that there was no compromise in the care that the patient needed. And I just thought that that was a very cool story that sometimes dentist or doctors and nurses kind of overlook oral complications because they're not looking in the mouth every day. And that's where it's very important to have a hygienist on an oncology unit to catch things like this and to have conversations with the patients and the medical team to really make sure that we're keeping all infections at bay to give them the best chance to fight the cancer that they have. Next is going to be your fungal infection. So this is going to be your candidiasis, and this is typically going to come up with those like white patches that kind of wipe off. What's different in patients with chemo treatment versus patients who don't is it's typically going to also burn. And once you remove that white plaque, it's also going to show a burn mucosa, just like mucositis. So sometimes if a patient calls you in, if you're working on an oncology unit, they may have already wiped off that white stuff and you may think that it's just mucositis. So it's always important to ask them whenever you go into a room with a patient that has cancer treatment to ask them, hey, I'm seeing these things. Did you do anything prior before me coming in? And the patient might be like, yeah, there was like these white patches. So that's really going to help you differentiate between mucositis and candidiasis. So modifications that we could talk to patients the first one's going to be your central lines and your ports. So making sure that you're talking to them about making sure that you're getting a pre-med. Always, always, always ask for that lab value to make sure that you know when you can deliver safe dental treatment, when you need to consult with an oncologist, or you need to proceed with precautions. Saliva is going to be the most important as well. The hygienist that I was learning from in the program, in her clinical notes, she actually has a section that talks about the saliva flow in the mouth. And it's important to document this. And I even started documenting this with all of my patients. Does the mirror stick when I am doing dental treatment? Does the patient complain about xerostomia, but the mirror isn't sticking? These are really good ways to let us know if their xerostomia is getting worse over time. So that way we can talk to them about, caries prevention and anything of that nature and making sure that they're not taking anything acidic. And when we're talking about chemo patients or oncology patients that are going through this, when we're not getting enough saliva, that's also going to harm the digestive system. So, talking to them about eating a soft diet because anything hard, they're going to have a very hard time breaking down that stuff and chewing and making their eating functions comfortable. So loss of saliva is also going to increase oral infections because we know that the bacteria in our mouth love to live in dry environments, and it can also cause the patient discomfort. So talking to them about saliva substitutes such as like xylitol gum or lozenges or any type of mouthwash that doesn't have alcohol is going to be best for these patients. So let's talk about brushing and flossing and cross contamination. So any patient that is immunocompromised, such as like HIV, even diabetes, cancer, sharing is not caring with them. So, I have some patients that say, oh, I use the same water pick as my husband. Okay, well, are you changing out the tips? Because if you're using the same tip as your husband, you're also introducing his bacteria inside of your mouth. Are your toothbrushes in the same cup? Because if they're in the same cup, they're all mixing all of that bacteria. You're going to want to keep your toothbrush away from everyone else. You're going to want to keep all of your dental stuff at home completely away from any type of cross contamination. Again, gently flossing above the gum line is going to be recommended for those patients that do not have the good lab results because you don't want to introduce any type of bacteria below that gum line. And you want to try to avoid anything that can cause trauma during these times. So telling the patient, hey, like using a floss pick could cause trauma. We might not want to do that. Or using an interdental pick can cause trauma. We might not want to do that. We might just want to stay to brushing and stay above the gum line. It also might be important to talk to the patient about not using an electric toothbrush during these times because an electric toothbrush can be a little bit too abrasive, especially if they're having mucositis or they're having any types of these issues, or if they are using that electric toothbrush, making sure that they're only staying on top of the tooth and not really angling it towards the gum line. Really, the best method is going to be that Bass method where we just use that circle motion with a soft, extra soft toothbrush to help them get through this while they're going through the oncology treatment. The other thing is brushing with peroxide periodically. I wouldn't recommend them doing this every single day because this is going to dry out the tissue. Maybe once a week they can brush with the peroxide to help lower that bacterial load. Harmful ingredients such as alcohol, um, whitening products, tartar control products, any type of ingredient in our toothpaste is going to also harm the patient. So making sure that you ask the patient, hey, what toothpaste are you using? And taking the time to actually know the ingredients of each toothpaste. So, for example, some toothpastes have a very low pH, which is an acidic pH. So, throughout my research, the best pH toothpaste is going to be your Arm & Hammer toothpaste. Some of your Crest toothpaste actually have a low pH, especially if they have whitening products in it. Colgate toothpaste are all over the place. So if a patient is telling you, hey, like I'm using Colgate, make sure you do the research to find out the pH of that toothpaste to make sure that you know that it's a good one for them. Because if we give them a pH that is lowering and we're a dry environment and we're having mucositis, that's going to cause the burning. So really watching what we're putting in the patient's mouth is very important. Some safer alternatives for the patient is going to be xylitol. So any type of xylitol gum or toothpaste is going to be important for the patients who, don't really care for fluoride. The nanohydroapatite is going to be important. I thought it was very interesting as well that green tea extracts can also help patients with the anti-inflammatory agents that are in there. Dental probiotics is also another good one to talk to the patients. The best practices for this is going to be gentle ingredients and neutral pH, and consider prescription toothpaste such as MI and other ones as well when fluoride is not tolerated. So that is a very, very short crash course on a 30-hour CE program that I took. There's a lot of information that I brought in. I just don't have all the time in the world to bring that down, but I hope that you guys learned a lot. Um, I do want to give a quick shout out to Kathy and Sue. So I've known Kathy and Sue for most of my dental career, and they've always had my back and they've always pushed me to do more and more and more. And I definitely think that we are in a time in dental hygiene where we're really ready to do more. We're capable to do more. So there's tons of presentation.
Thank you so much.